Professor Brian Oldenberg. I work in the Nossal Institute for Global Health at the University of Melbourne. I'm a Professor of Non-Communicable Disease Control, so most of my work is international, particularly around the Asia-Pacific region and also some countries in sub-Saharan Africa. And the work we do is really to help countries develop better and more effective responses to controlling chronic conditions, chronic diseases, particularly diabetes, hypertension, cardiovascular disease, which are really epidemics in all of these countries now. And this involves both developing better responses in terms of health promotion and prevention, but also healthcare delivery to help people more who actually have these conditions as well. So our WHO Collaborating Centre, which is focused on implementation to improve NCD or non-communicable disease outcomes, really involves working with the health ministries and governments in these countries to provide technical advice, support and capacity building and training to those organisations to help them develop better policies, more effective policies, or maybe to implement more effectively the policies they've already got to improve the response to prevention and chronic disease management. This has happened pretty quickly, in the last generation. So healthcare systems and healthcare delivery in these countries has not been able to respond quickly enough to these conditions. So a lot of people with high blood pressure in these countries don't even know they have high blood pressure. So that then increases their risk of stroke and many other secondary conditions. Many people in these countries already effectively have diabetes, but they don't know this. So better health services, better screening, better diagnosis will identify people with these conditions and then help people get better access to treatments, both medical kinds of treatments and medication and so on, but also more effective programs to change lifestyle and reduce risk of these conditions as well. We were only formally designated as a WHO Collaborating Centre just over 18 months ago. So to be honest, we're still really working out the sort of full work program with our colleagues in WHO and people in these countries. And also because we are designated through Geneva, we sort of have this global remit as well, which is a bit overwhelming. So we've realised over time that it's better that we would focus on a few countries, that we can get some early wins and runs on the board. So focusing on countries like Sri Lanka, India, Bangladesh, Kenya. These are countries that we already have a pre-existing relationship with, the health ministries and governments, but also these are countries that we also have other collaborating partners in healthcare delivery and university partners as well. So a lot of the work we're doing related to implementation and improving implementation is trying to join up the dots and see if we can help the various sectors and organisations to partner together so that they can more effectively implement the solutions that are potentially there, but there's not a lot of resources to work with, so people, these organisations have to work together very efficiently, I would say. The big vision is that WHO, with all of its member states, have signed on to very ambitious sustainable development goals related to health by 2030, and the health goals related to the SDGs, these are driven to a large degree by these epidemics of cardiometabolic diseases and the cancers and the behavioural and other risk factors that are related to these. So if we can help countries do a better job of implementation, policies related to increasing physical activity, reducing obesity, making essential medicines available to people, then these countries can have a better possibility of getting closer to those SDGs for health than they otherwise might have been able to do.